How can healthcare providers stay ahead of the curve to make sure they are delivering the best care to their patients? At our NG Healthcare Summit, Andrew Lang, CIO and SVP at Wellpoint, talked about why it's difficult for physicians to stay current due to the vast amount of patient data available.
So what is 59%? So 59% is the number of percent of Medicare patients that actually got the proper care when they had cancer. So not a very good stat. So there's a number of other studies like this, and I'm sure many of you have seen these studies, and it just shows that we aren't bringing the best care possible to patients. And clearly this isn't because physicians don't want to. I would argue that for the most part, and many of the studies support this, is that it is the lack of the information being available to the patient, to the provider at the point of care for the patient, and not being able to apply the best care and best practice solutions for them. And you can see here, it's at best 60% of the time you get it right. I read somewhere that we are now approaching a new age, and it's the age of data. And clearly this stat here, what is 1.9 trillion? That's the volume of gigabytes that were created just last year. So I think we're already in the age of data. In the medical industry, this is the first bullet talks about medical information is doubling every 5 years. Actually, just read that's accelerating, so we're actually going to see that come out even faster. Very difficult for providers, physicians to stay current with all that information. And then if you look at the last bullet there, the information which you thought was a fact, with the next study that comes out, 13% of the time, it reverses. So a fact is no longer a fact. So not only do the physicians have to keep up, they have to keep current constantly with the information that's coming available.
Interested in the intersection between big data and healthcare? Join the conversation at our next NG Healthcare Summit.